It seems like you might have felt ignored or misunderstood by your friends, your children, or even by yourself. It's possible that you are unaware of these 5 mistakes, and you are over 70 years old. Today, I will reveal to you what they are. The aging process is similar to that of a house that has withstood the passage of time. At first, everything seems solid, functional, and fresh, but over time, small cracks appear. A door that doesn't close properly, a leaky pipe, or stains on the wall that we ignore. Over time, these things become so commonplace that we don't even notice how disturbing they can be to others. As we age, our attitudes also change. We adopt unpleasant behaviors without realizing it. Not only do these behaviors make others uncomfortable, but they also make us feel emotionally distant from them, as if our personality is slowly crumbling. One day, we become the person we swore we would never be. This video will show you 6 shocking but common behaviors that we adopt as we age, often without realizing it. We're not talking about wrinkles or physical ailments. Rather, we're talking about attitudes that we justify by saying, "I'm old," or "I just do that." These behaviors can not only make us uncomfortable, but also turn us into our worst selves. The last 2 attitudes will make you reflect on your attitude towards this phase of life. That's why I encourage you to read to the end, because these uncomfortable facts are not for the weak but necessary to improve the quality of your life and your relationships. 1. Lack of personal hygiene. Lack of personal hygiene is a common problem among the elderly. It can be due to various factors. Physical difficulties such as chronic pain or fatigue can be a problem for the elderly. Some elderly people also experience a lack of motivation due to depression, loneliness, or the belief that they do not need to maintain a good appearance. A lack of hygiene can also occur, for example, it is possible that they do not shower or change clothes as frequently, or that they do not brush their teeth properly. This can lead to a series of problems. Body odor is the most noticeable problem. It can be unpleasant both for the person experiencing it and for those around them. Dirty or poorly cared for clothing can also contribute to a disheveled appearance, affecting how the elderly are perceived by others. Poor personal hygiene can also increase the risk of infection, especially if the person has pre-existing conditions or limited mobility. Good personal hygiene is essential for the emotional and physical health of the elderly. It not only helps prevent diseases and infections but also improves the quality of life by providing a sense of autonomy and well-being. Therefore, it is important for the elderly and their caregivers to pay attention to this issue. In some cases, the intervention of a healthcare professional or the assistance of a caregiver may be necessary to ensure compliance with adequate hygiene practices. 2. Complaining about everything. It is easy to acquire the habit of complaining constantly over the years. What starts as a mild criticism about something we don't like can turn into growing discontent. We criticize the government, the weather, technology, and even today's youth. We complain about everything without realizing it. The attitude we adopt affects not only our well-being but also that of those around us. Our negativity can make those who listen to us, especially our children, grandchildren, and younger friends, feel tired or even distant from us. Living in a constant state of complaint can create a negative and heavy environment that can make people avoid us. It is understandable that as we age, our experiences make us more critical of life. However, not everything deserves to be criticized. Often, it is better to accept the things we cannot change and focus on the positive. This will not only improve our mental health but also our relationships. Lead the conversation by contributing your experience and years of accumulated knowledge. 3. Dominating the conversation. Many elderly people feel compelled to lead the conversation. They have a lot of wisdom and stories to share. It is a mistake to dominate the conversation, which can negatively impact our relationships with younger generations. We send a message when we interrupt others, impose our opinions, or do not let them speak. It says that we are not interested in what they have to say. This can lead to our children, grandchildren, or friends feeling frustrated or demotivated when trying to express their opinions or experiences. It is important to remember that although we have good intentions and want to share our knowledge, communication is not a monologue but a dialogue. Asking questions and showing genuine interest creates an atmosphere of respect and connection. Additionally, We enrich ourselves by learning to appreciate the new ideas that younger generations bring. We can strengthen our relationships by allowing the conversation to flow naturally. 4. Demanding respect based on age. As we get older, we can make the mistake of assuming that respect is automatically due to our age. While it is true that in many cultures old age is associated with wisdom, authority, and knowledge, respect does not come from the number of years but from how you treat people and how you behave. Demanding respect and not reciprocating can be a source of tension, especially when dealing with younger people who may feel pressured or misunderstood. Respect is earned by listening to others' opinions and treating them with dignity. Although life experience can be a valuable tool, expecting special treatment or imposing your ideas on others because of your age can create barriers. Remember that reciprocity is the basis of genuine respect. We must demonstrate to our children, friends, or grandchildren that we respect their opinions, decisions, and life paths if we want them to respect us. These attitudes and behaviors are crucial to consider as they significantly impact the quality of life and relationships for the elderly. By being mindful of personal hygiene, avoiding constant complaining, fostering respectful communication, and earning respect through actions rather than age, the elderly can maintain stronger, healthier relationships with those around them. We can earn the respect and affection we desire by maintaining an open and understanding attitude. Minimizing others' experiences can often become a trap, especially as we reach a more advanced stage of life. It is easy to minimize the concerns or problems of others when we have decades of experience, challenges overcome, and accumulated knowledge. This behavior can cause serious damage to our relationships. We deny others the opportunity to grow and feel understood when we make them feel that their feelings are unimportant or that their problems are trivial. Remember that although our life experiences are significant, each stage of life brings its own challenges. What may seem trivial to us can be enormous for someone else. Minimizing others' experiences can generate frustration, misunderstanding, and alienation, especially in the case of children and grandchildren. It is better to listen and validate their feelings without comparing. Not only do we strengthen our emotional bonds by creating an atmosphere of respect and support, but we also create a conducive environment. Criticizing the younger generation too much is not uncommon for elderly people to fall into the temptation of criticizing the younger generation for their choices, lifestyle, or values. Although this behavior is often motivated by the desire to impart wisdom or warn of potential mistakes, it can create a barrier between generations. Constantly criticizing the younger generation creates an atmosphere of tension, mistrust, and resentment. Instead of fostering dialogue and understanding, it leads to an insurmountable wall. Although it is easy to judge based on personal experience, each generation faces different challenges and circumstances. Even well-intentioned criticism can be interpreted as a lack of support or rejection of current lifestyles. Remember that the younger generation is like us. They are learning and finding their way. The best way to help them is by being patient, showing wisdom, and giving advice when asked. Relationships between generations can flourish when we cultivate an attitude of mutual respect and understanding rather than one of criticism and condemnation. Living in the past is a common mistake many elderly people make without realizing it. Clinging to past memories can lead to an idealization of those times. However, this approach can make it difficult to adapt to changes and enjoy the present. It is normal to share and value past experiences, but when this becomes the only reference point for the future, it can lead to disconnection from the present and frustration. The world is constantly changing with new ideas, technologies, and ways of life that require flexibility and openness. Living in the past also alienates loved ones, especially the younger ones who do not feel valued or understood in their current environment. To live fully, we must find the right balance. We must appreciate our past but not let it define us, and we must cultivate openness to the present to continue growing and experiencing new things. It is important to adapt to the modern world and maintain a receptive attitude. Rejecting help as one ages can be a common attitude and can have serious consequences for the emotional and physical health of the elderly. As people age, they face challenges such as memory loss, mobility problems, or difficulties performing daily tasks. Many elderly people feel proud or want to be independent and do not accept help from their family or friends. The refusal to accept help can be motivated by the feeling of losing autonomy. For many elderly people, being able to take care of things themselves is important for maintaining their dignity and feeling valued. Needing help is often seen as a sign of weakness or dependence, and this can be difficult to accept. This attitude can be influenced by concerns such as the fear of being a burden to their family or losing control of their lives. This attitude can put their health at risk, and the quality of life can be affected by refusing to accept help, whether for daily tasks such as cooking, cleaning, or shopping, or for receiving medical care. Elderly people can suffer accidents such as falls or develop more serious health problems if they do not follow medical instructions. This refusal to accept help can also cause family tensions because loved ones often try to help but in vain. Social isolation can be a painful and concerning reality as people age. It is not uncommon for people to lose social connections as they age due to retirement, the loss of family and friends, or physical limitations that restrict mobility. However, some elderly people choose to isolate themselves instead of actively seeking new ways to relate to others. This can have detrimental effects on their mental and physical well-being. Social isolation not only can cause emotional emptiness but also various health problems. Prolonged loneliness can increase the risk of depression, anxiety, and other emotional disorders. The lack of social contact prevents obtaining the emotional support necessary to face daily challenges. Isolated elderly people are less likely to participate in stimulating activities. This can accelerate cognitive decline. The lack of mental stimulation, such as participating in group activities, conversations, and other group activities, can lead to memory loss. Isolation can also lead to a loss of motivation for self-care.